Now, for the next very important thing which we are going to discuss is another aspect, and this is what is known as the adrenal gland suppression. Adrenal gland suppression. So, if the adrenal gland, is a gland that is producing a lot of hormones, aldosterone, good guys. If it is suppressed, that means those hormones will not be produced adequately. So, if you want to know the bad things that could happen, you always need to know the good things that could have happened if the hormone is there. You understand? So you know the normal to be able to know the abnormal. So you can also call it adrenal insufficiency. The adrenal gland is not able to function very well. So adrenal gland is a gland that is on top of your kidneys. It's like a cap on your kidneys. I don't know if I brought a better picture. Nice. So you have your kidneys like this, you have the adrenal gland on top of it. So this gland has a lot of functions, and if these functions are disrupted, you have a lot of issues, you know. So adrenal gland suppression usually occurs when the hypothalamic-pituitary-adrenal axis is suppressed. So it leads to inadequate cortisols because cortisol needs to like trigger. Do you understand? So it's often caused by the person has taken too much all those corticosteroid therapies, prednisone, most at times. So if you are taking too much of it, all of a sudden you want to stop and you now have issues. Do you understand? So what it means is a form of secondary adrenal insufficiency where the adrenal glands fail to produce uh, enough cortisol because external steroids. Okay, like basically, right? The adrenal glands produce all those cortisols, aldosterone, and all of that, but its function was kept on a low because you were taking man-made kind of like cortisol for a very long time that the adrenal gland kind of like lost how like you need to keep exercising things to keep getting results, right? So it has not produced for a very long time, and all of a sudden you're now trying to say it should start producing. So mechanism, exogenous glucocorticoids. You are bringing something from outside that was same thing as adrenal was producing. So adrenal now say, okay, let me rest my work since you are bringing something from outside. It's just like you have a girlfriend, you're trying to get a side chick. Do you understand? So we have prednisone, dexamethasone. They provide negative feedback to the hypothalamus and pituitary. Do you understand? As though please don't trigger the adrenal gland because we are already here. So after all of a sudden you want to now stop taking them, then the adrenal is like, no, I will not produce since I was here, but you're now bringing people from outside. So systemic corticosteroid causes and risk factors. If you are taking systemic corticosteroid therapies, you are taking it for a very long time, potent or long-acting corticosteroid, dexamethasone, betamethasone, then non-physiologic dosing schedules. Probably you are just taking it without the advice of a medical doctor. Then other medications like megestrol acetate, medroxyprogesterone, okay, treatment of endogenous Cushing syndrome. Okay, after removal of a cortisol producing tumor, maybe there was a tumor in the adrenals or all of that. So this is what we got. So clinical manifestation is the person is weak, dizzy, nausea, weight loss, poor appetite, hypotension, tachycardia, risk of shock. Metabolic signs, low blood sugar, that's hypoglycemia, electrolyte disturbances. Adrenal crisis is vomiting, dehydrated, confused, can even collapse. It's a medical emergency by then. So diagnosis is you try to measure the levels of serum, cortisol, which is usually low, then the ACTH stimulation test, insulin tolerance test, methyl test, salivary cortisol levels too. Try to measure it. So management, always use the lowest effective or corticosteroid dose. Don't always use corticosteroids anyhow. Those drugs that I was listing. Then treatment is Supplemental corticosteroid during stress, hydrocortisone replacement therapy if it is so severe, supportive care for the hypotension, hypoglycemia, replace glucose, electrolyte imbalance, try to replace dehydration, try to replace fluids. Those are all supportive treatments.